Hey guys, welcome to Total Health Live with Dr. Sedano. I am Dr. Nick Sedano, and I am so glad that you're here today because we've got a fantastic topic. In fact, it's one topic that most Americans suffer with every single day, and that is migraine headaches. Now, just because this is a migraine headaches topic, that doesn't mean it doesn't apply to other types of headaches, but primarily we're going to speak about migraines today. So before we get into it, migraine headaches affect 38 million Americans and actually 1 billion people worldwide. So that's 1 out of 7 people in the world suffer from migraine headaches. Every 10 seconds, somebody is being rushed to the ER with a migraine headache, and 1 out of 4 American households have a migraine sufferer. So that is just unacceptable. So hopefully today's topic is going to help really release the shackles from a lot of you who are suffering with migraine headaches. And by the way, women, and I know there's usually a lot of women online with us right now, women, you suffer with it 3 times more than men do. 1 out of 4 women will have migraine headaches. And I know you know that because you probably talk to your friends and it just seems like everybody's got migraines lately. Now, what breaks my heart the worst is what's happening now with our children. We're seeing more and more children with migraine headaches, and I know that's got to break your heart as much as it does mine. I've got 5 children, so you can imagine if one of my kids gets a headache, I just struggle with that. So I always do the best I can to make sure we get rid of it quickly. But today we're going to be talking about, and really I've got my office manager here, Amanda, and by the way, I just want to let you guys know, she does not want to be here. She does not like being on camera, and actually she's not even supposed to be here right now because we're not even open yet. She's not supposed to come in until 3, and I didn't threaten her with a job. I didn't do that at all. So she's here because she really wants to be here because she doesn't want anybody else suffering like she used to, because she was a migraine sufferer since what? You were a little girl.
14.
Yeah, 14 years old. Wow. So what was it like back then as a young girl growing up? You know, you're just starting to, the hormones and things are starting to kick in. What was it like growing up with migraine headaches when, your social life is kicking in also at that time and you can't do a lot of things?
Yeah, I missed 1 or 2 days of school a month at least. Mm-hmm. And yeah, you really didn't have much of a social life when you've got what feels like 1,000 little elves with sledgehammers running through your head.
Yeah, you told me that. It's like little elves like picking like electric shocks and elves like with hammers in your head. Yeah. And I think you used a term one time, you said it felt like you had an ice pick going through your head.
Yeah, I would get, that was like the pre-pain for my migraines. That let me know that it was coming was, I would have felt like an ice pick literally just jabbing in my head.
Tell me something, you and I discussed this before. When you were about 14 years old in particular, something happened where it really affected you. What happened when you were 14?
There was one day where my migraine was so bad that I'd taken everything that I could over the counter, and I'd taken all the prescription narcotic pain medication that I could, and it wasn't getting any better, and I was banging my head against the wall because it just hurt so bad.
I can't even imagine that. Ladies, I've got a pretty high pain tolerance. I can take maybe a level 2 or 3 migraine. There's no way that I could take it to where I wanted to bang my head against the wall, which is then creating a whole nother set of headaches, right? And by the way, if any of you have questions, go ahead and type it into the comment bar. I'll keep an eye on it. I've got my phone out, so I'll be answering any questions you might have. Or if you want to direct any questions towards Amanda, she'd be more than happy to answer them too for you. So now, I remember you telling me that you also had other types of problems with your migraines. I think you said you had seizures even as a result of it, or seizures were going on at the same time you had the migraines.
They started before the migraines started, and before I would have a seizure, I would have that ice pick sensation before the seizure started.
So the migraine almost led into the seizures then?
Right.
Wow. So ladies, by the way, if you have any special problems that you had or triggered any other health concerns, go ahead and put it into the comment bar. Let us know. Maybe we can help shed some light on what's going on. But I can imagine a migraine being bad enough for it to then trigger a seizure, which is a whole nother issue to where you're pretty much out of control at that moment. Mm-hmm. How scary is that, especially as a young girl going through that?
Yeah, because I was 12 or 13 when the seizure started. It was pretty scary. The first one happened when I was in gym in middle school.
And I'm sure you were on some pretty serious medications at that point too for the seizures as
Yeah.
well as the migraines.
Yeah, you had to be monitored every month. You had to go in for blood work and go in, every month or two for
Wow.
EEGs and.
So you had brain scans done. For those of you out there, an EEG or a QEEG, it's called a quantitative electroencephalograph. And that is where you put a skull cap on and it's got 12 sensors. We also do that in our office where we do brain scans on patients who have ADD, anxiety, panic attacks, things like that. So you would actually get a full-blown neurological brain scan done. And how often did you have that done?
About every few months, I think.
Wow. So every few months to see exactly this firestorm going on inside of her brain. And a lot of you could relate to that. Maybe you don't have the QEEGs done, but you can relate to just this firestorm inside your brain. And it's serious. Like I said, I don't do well with pain, especially headaches. To me, a level 2 or 3 is enough. I want to go just lay down by myself. I couldn't imagine it. Now, I remember when I was doing the research for this, 90% of the people that suffer with migraines can't even function at work. How did you get by with that, or even be able to function in school?
I don't know.
I guess you put on your Mary Poppins.
I put on my Mary Poppins face.
She has a Mary Poppins face she says she puts on, and that way she can just kind of get through the day and you'd never know something was going on.
I've got a high pain tolerance, and I just do what you got to do to get through it.
And you said you missed school as a result of it, so that got you behind in your grades, I'm sure, at some point. I can't even imagine what that's like. Now, I remember you telling me one time there was an incident when you were driving with a friend in a car, and this is serious. This is really serious when it gets to this point. What did you tell us about what happened with that?
I was in my 20s, and I was in so much pain that I literally said, if there was nobody in the car with me, I would just drive it off the cliff to end it because I couldn't get any relief. And I ended up in the ER that night because of the pain. And
I'm on morphine or some other type of just numbing drugs.
Yeah, they would give you a shot, and the only thing about the shots was with me, it would last for maybe an hour, and then the headache would be right back. So it didn't really do any good to, go in there for a shot. But at that point, I just needed a little bit of relief.
Yeah. I remember you telling me, too, that you were on, and a lot of you experience this, you might be on different psychotropic meds. Did they actually put you on any of those?
Yeah, I've been on so many different medications trying to prevent the migraines and manage them. There's quite a few of the psych meds and beta blockers and...
Heart medications? Wow. So they actually had her on heart medications and psychotropic meds. Now, just so you guys understand, when we've done seminars that we do on our Facebook Lives on psychotropic meds, those are types of medications that are mind-altering. And typically, with all psychotropic meds, the number one side effect of that is suicide. Did you ever have, other than that incident of where you were wanting to drive in the car, any other times?
I can't pinpoint it to... I know that there was a couple times where it was pretty bad, but
You just didn't want to go on.
Yeah.
Yeah.
It hurts.
And I could imagine as a parent, whether you're 20 years old or so at that time, or a 14-year-old girl or boy for that matter, that you've got to wonder what's going on when your kid's not around. If your kid's suffering from migraine headaches, are they wanting to, unfortunately, end their lives as a result of it? This has got to be a scary thing for any parent.
I never confessed to my mom that, so if she sees that, sorry, Mom.
Well, I'm saying this only because that many of you who have children that are suffering with migraine headaches, this may be going on in their mind and you're not even aware of it, that you need to be, conscious of that. That, if they're on a psychotropic med, whether it be for that or ADD or depression, big one is depression these days. They put these children on psychotropic meds, and there's between 6 and 7 million children in this country on psychotropic meds. You need to know that the number one effect of that is suicide. So be very aware if you put your child on that there could be serious consequences as a result. I remember you telling me something interesting about how it actually affected your being on these medications, your hair follicles? or something like that?
So there's certain types of migraine medications like Imitrex and Axert and Frova that you take at the onset. So it's not a narcotic. It's not just like a painkiller that numbs it. But it's for migraines. So you take it when you first get it, and then it's supposed to, get rid of the migraine. Well, most of the time it didn't get rid of the migraine, but even if it did help it, every single hair follicle on my body would hurt worse than the migraine.
So
I'd rather have the localized migraine than the whole body.
So your whole body was so hypersensitive that anything touching it could have set you
over the edge.
off. So instead of having all these ice picks in your head or these little elves in your head, it's almost like having them all over your body. Wow. Yep. That's amazing. And guys, we're going to be doing another Facebook Live tonight. So this week is going to be about migraine headaches or headaches in general. So if you want to get more information on this, tune in tonight about 7:30 to Total Health Solutions with Dr. Nick Sedano, and we're going to be discussing actually what we did to help Amanda get rid of her migraines, because you don't have to suffer with this anymore. I find it amazing to me how many people are suffering with migraines that really don't need to anymore. It could become a thing of the past. So what would you recommend to the people watching? What would you say to them as far as how they could be helped with this? You
don't think about it as far as when I came in to work with you. You don't think about certain things helping, like, totally get rid of
you were
migraines.
Skeptical. Now I want you to know something. I don't mean to cut you off. Amanda worked in the medical field, so when she started working with me, she came with a medical mindset, and so I remember you being skeptical that, or what we're going to do, is it even going to work?
Right, because I had gone to a couple different chiropractors for symptomatic relief of a migraine.
Yeah,
and it would help, but I never went to actually correct the cause.
Yeah.
So when I started getting taken care of here, but I had 2 in a year and a half.
Almost 2 years.
Yeah.
In June it'll be 2 years, and she's only had 2 of those headaches. And I remember one
was really bad, where it was like my typical migraine, and then the other one.
Did it go away quicker though?
Yes, and then the second one never went 100%. It was maybe 60%.
Yeah.
And it just lasted the 1 day and not the 2 or 3 days.
Yeah. So the headaches that she's experienced in almost the 2 years of working with us have been just 2 headaches in that whole time, where you used to have them much more frequently than that. I mean,
oh yeah.
How often would you say you got them before?
Several a month.
Yeah. So when you have several a month, and I take that as almost weekly. Yeah. So a weekly migraine, you would have had dozens and dozens by this point, and instead you've only had about 2. So, and we always say that, what we do here, there are things that you do in your daily life that can re-trigger it. And we'll be going over triggers tonight. So you guys, please tune in tonight. We're going to be going over a lot more information, a lot more in depth. Amanda won't be on with me tonight because she, like I said, she doesn't really want to be here right now, but she's here because she truly wants to help people. And I'll tell you, I applaud her for getting out of her comfort zone and being on today, because she knows that a lot of you are suffering with migraines and do not need to suffer any longer. There is help. It could be completely helped. And I think the thing that's different about us is that we get to the cause of it. It's not about treating symptoms. It's not about drugging you, whether you have your drugs of choice. Didn't you tell me that there were certain things? You've got your little daily remedies you try. You've got your over-the-counter medications, and then you got the really strong stuff, which we're going to get into tonight. But what were some of the things you did, your little daily remedies, your home remedies, we call it?
If I felt it coming, I would do like a Coke and a Snickers.
Yeah.
And if I felt it coming, but it was a little bit stronger than just like the beginning, I would go ahead and throw in like ibuprofen.
Yeah.
So that little.
And there's your home remedy to your over the counter, and then of course, we've had patients with full blown injectable Imitrex and things like that. I'm going to talk about it tonight, but I had a lady come to me many years ago with something she called basilar migraine, which literally would paralyze one half of her body. And I'll never forget when she came in to see me from Florida, she was draped over her husband and he carried her in. We had to turn the lights out. We had to see her after hours when no patients were in the office. And I'll never forget, she said to me, if you don't get me well, I don't want to live anymore. And that just hit so hard. And so the week that she moved up here to get help, every other day the migraine was gone, which in her terms, she said that never happened before. It was always every day for at least 2 weeks. And we then eventually found her help when she moved back down to Florida, or not moved, but went back home, and she's headache free.
I will say this. I wish that my parents or I knew about this years ago.
Yeah.
Because I've suffered 30 years.
Yeah, wow.
With migraines.
Imagine 30 years, and it's gone within a matter of weeks. Mm-hmm. Yeah. So guys, like I said before, you don't have to suffer anymore. You can choose this information. By the way, the reason we got on today wasn't just to have what I call a jacuzzi moment where it's all nicey nice, it feels nice. It's, hey, that's good information, doc. We got on today, and she's here today, not really, I don't want to say kicking and screaming. She's here today because we're both passionate about helping people with migraines and headaches. And we know we can help you. So you could either do nothing. It's your choice. You can, one, do nothing. You can continue living with your migraines, taking your medications, being away from your family, being locked up in a room or your bedroom with an ice pack over your head, over your face, with a garbage pail right by your bed where you throw up in it. Or you can get help. And all you have to do is call. Just give us a call. We'll tell you if we can help you or not. We'll be honest with you. It's the only way I know how to be. And we'll do an exam, an evaluation, and let you know if the problems that you have with your migraines are coming from somewhere that we can help. So all you have to do is give us a call. I'm going to put the contact information on the Facebook page. So you'll be able to contact us. You'll be able to, through email, through our phone number, let us know. And also, too, what we'll do is, if there's somebody you know that's out of state, so if you're in the Alpharetta, Georgia, Crabapple area, or if you want to travel, you can come and see us. But if you're out of state or somewhere else, we'll help find you a chiropractor. We'll help find you a qualified, excellent doctor somewhere where you are, so that way you can get the help. But you don't have to suffer with this any longer. So anything else you want to say? I think
I'm good.
You're good. I think you hit it on the head when you said that I wish you knew that your parents knew that they could do something about this 30 years earlier. So guys, once again, watch tonight. We're going to be talking about this extensively tonight in a lot more detail. And it's just me, no Amanda tonight. And, oh, shucks.
Darn.
I know, you're going to be so disappointed.
I'm so sad.
You might be watching remotely, though.
It's so sad.
You could always comment in. You could just kind of comment and
there you go.
Say I'm there in spirit. Anyway, guys, thanks for being on Facebook Live with us. Hopefully this gave you great information. And like I said, you don't have to suffer anymore. Let us know how we can help you. Call us, email us. I'll put the information, but I'll give it to you quickly right now. Our office number is 770-751-5700, or you can email us at totalhealthsolutions with an S, the number 1, @gmail.com. That's totalhealthsolutions1@gmail.com. Thanks for being with us, guys. And like tonight, and we're going to have some great information on how to no longer suffer with migraine headaches. Thanks, guys. Have a blessed day. Bye-bye.